Magnesium glycinate has become one of the most popular supplements out there. And for good reason. It helps calm your nerves, supports your muscles, improves sleep, and can even help your blood pressure. But here's what most people don't realize. Taking magnesium glycinate the wrong way can actually hurt your kidneys instead of helping them. Yes, the same supplement that's supposed to support your health can quietly strain your kidneys, especially if you're over 50. And I've seen this happen again and again in my clinic. So before you reach for that next capsule or scoop of powder, you need to understand how your body really handles magnesium and what can go wrong if you're not careful. Because once the kidneys start showing signs of stress, the damage can build up silently for months or even years. I'm Dr. William Lee, physician, scientist, and author of Eat to Beat Disease. In today's talk, I want to walk you through exactly why magnesium glycinate can be both a hero and a hidden risk, and how to use it safely, effectively, and in a way that supports your kidney health for the long term. Now, let's start with a simple truth. Your kidneys are your body's natural filtration system. They clean your blood, remove waste, balance minerals, and keep your fluid levels just right. And magnesium, an essential mineral, plays a critical role in this process. But here's the catch: your kidneys are also responsible for excreting excess magnesium. So if you're taking too much or taking it in the wrong combination with other supplements, medications, or dehydration, your kidneys have to work overtime. For a healthy 25-year-old, that might not be a big deal. But for someone over 50, it's a very different story. See, after 50, our kidney function naturally begins to slow down. Even if your lab results look normal, your filtration rate, what doctors call GFR, often drops slightly every year. Combine that with the fact that many people in this age group have high blood pressure, diabetes, or are on medications like diuretics or ACE inhibitors, and your kidneys are already under more pressure than you think. Now imagine adding daily magnesium glycinate, maybe 200, 400, even 600 milligrams a day on top of that. If your body doesn't need that much, or if your kidneys can't clear it efficiently, magnesium starts to accumulate in your bloodstream. And that's when subtle warning signs begin. You might notice fatigue, nausea, or muscle weakness. Some people describe it as feeling sluggish or off. But the truth is, these could be early symptoms of your kidneys struggling to keep up. I've met patients who thought their magnesium supplement was helping them sleep better, only to later discover that their kidney function had dropped by 15 to 20% over the course of a few months. Now, am I saying magnesium glycinate is bad? Absolutely not. In fact, it's one of the most gentle and absorbable forms of magnesium. It's especially helpful for people dealing with stress, poor sleep, or muscle cramps. But like any nutrient, the dose, timing, and context matter. And this is where so many people go wrong. They take magnesium glycinate with the wrong combination of foods or supplements at the wrong time of day, or in quantities their kidneys simply can't process efficiently. Here's something most people never think about. Magnesium absorption isn't just about how much you take. It's about how your body uses it in real time. If you take it when your body's magnesium levels are already high, or when your kidneys are trying to manage other electrolytes like sodium and potassium, you can create an imbalance that forces your kidneys to work harder than they should. So in this video, we're going to talk about the 3 biggest mistakes people make with magnesium glycinate and how to correct them using simple, science-backed strategies. But before we get into those mistakes, I want to take a step back and talk about why magnesium is so important, especially for men over 50, because understanding the why makes it a lot easier to understand the how much and when. As men age, several changes happen inside the body that affect magnesium metabolism. Muscle mass begins to decline. which means your magnesium storage capacity decreases. Your digestive system becomes less efficient at absorbing nutrients, and often you're juggling medications for blood pressure, cholesterol, or prostate health, all of which can subtly affect how your kidneys and liver process minerals. This is why I always tell my patients after 50, your body is playing by a new rule book. What worked for you at 30 or 40 might not be safe or effective anymore. Now, the good news is that you can still safely benefit from magnesium glycinate, as long as you follow a few simple timing and lifestyle adjustments. In the next section, I'll explain how magnesium works in your body and the surprising link between magnesium levels, kidney function, and hydration. Because the number one reason most people experience magnesium-related kidney issues isn't overdose, it's dehydration. Let's talk about how magnesium really works inside your body and how your kidneys fit into the picture. When you take magnesium glycinate, it dissolves in your stomach and passes through your small intestine where it's absorbed into the bloodstream. From there, magnesium travels to your muscles, nerves, bones, and organs, places where it acts like a molecular switch controlling hundreds of different reactions. It helps your muscles contract and relax. It keeps your heart rhythm steady. It regulates blood pressure, and it supports the enzymes that manage energy in every cell. Now, here's the interesting part. Your body is constantly balancing magnesium levels. If you get too little, your nerves and muscles become overactive, leading to cramps, fatigue, or restless sleep. But if you get too much, your body depends on your kidneys to filter out the excess. And that's where the problem begins for many people. Your kidneys filter about 180 liters of blood every single day. That's roughly your entire blood volume filtered 30 to 40 times daily. They remove waste, balance fluids, and fine-tune minerals like sodium, potassium, calcium, and magnesium. But when your kidneys are dehydrated, sluggish, or already dealing with other challenges, like high blood pressure or mild diabetic changes, that filtration system becomes less efficient. Think of your kidneys as a coffee filter. When the filter is new and clean, everything flows smoothly. But if it's clogged or dry, the flow slows down and residue starts to build up. The same thing happens when you take magnesium glycinate without enough water, because magnesium relies on water to be carried safely through your bloodstream and excreted in urine. Without proper hydration, magnesium becomes more concentrated, forcing your kidneys to work harder to maintain balance. Over time, this can cause microscopic stress, small amounts of inflammation or mineral deposits that, if ignored, can accumulate. That's why I tell my patients, if you're taking magnesium, you must pair it with adequate hydration. A good rule of thumb is to drink a glass of water, at least 8 ounces, with your magnesium supplement, and another one within an hour after taking it. Now, let's clear up a big myth. Magnesium glycinate is often called kidney safe because it's chelated, meaning it's bound to the amino acid glycine, which helps improve absorption. And that's true. Glycinate is one of the most bioavailable forms, and it's gentler on the stomach compared to others like magnesium oxide. But even the most efficient form can become problematic if your kidneys are already under strain. For example, if you're taking magnesium along with high doses of vitamin D, calcium, or zinc, all of these minerals compete for the same excretion pathways in the kidneys. This means your body has to juggle multiple minerals at once, and that balancing act can sometimes tip in the wrong direction. So if you're taking a multivitamin that already contains magnesium, plus an extra magnesium glycinate capsule, plus fortified foods, you could be consuming more than your body actually needs. The key here isn't to avoid magnesium. It's to personalize it. Here's something you can do tonight. Check the back of your supplement label. Add up how much magnesium you're really taking. Many people are surprised to find their total daily intake is 500, 600, even 700 milligrams. well above what's necessary. Most adults only need around 300 to 400 milligrams of elemental magnesium per day. And that includes what you get from food. So, what's the right way to take magnesium glycinate? Timing and context matter. Your body absorbs magnesium best when your insulin levels are stable and your digestive system isn't overloaded. That means avoiding magnesium right after a heavy meal or pairing it with high-fat foods. Instead, the ideal time is usually in the evening, 1 to 2 hours after dinner or about 30 minutes before bed. That's when your body's natural repair systems kick in and your kidneys are in a calm, balanced state. But here's an important exception. If you have kidney disease, reduced kidney function, or you're taking medications like diuretics, ACE inhibitors, or NSAIDs regularly, you should always check with your doctor before taking any magnesium supplement. Because in those situations, magnesium can accumulate faster than your kidneys can handle. In the next part, we're going to get very practical. I'll break down the 3 biggest mistakes people make when taking magnesium glycinate and how to correct each one using simple adjustments in timing, dosage, and lifestyle. You'll also learn about one overlooked habit that silently stresses your kidneys even more than high magnesium intake, and how to reverse that starting tomorrow morning. Now let's get practical. If you're taking magnesium glycinate or thinking about starting, these are the 3 biggest mistakes that can quietly stress your kidneys and how to fix them safely. Let's start with mistake number 1, taking magnesium on an empty stomach or first thing in the morning. Many people do this because they've heard it helps with energy or focus. But here's the problem. When you take magnesium glycinate on an empty stomach, absorption can spike too quickly. Your bloodstream suddenly gets a high dose of magnesium, and your kidneys have to respond immediately to balance it out. For a younger person with strong kidney function, that might not cause a problem. But for someone over 50, your kidneys don't regulate electrolytes as quickly as they used to. That sudden surge can cause mild stress, dehydration, or even dizziness for some people. The fix: take magnesium glycinate after a light meal, not before. The presence of food slows absorption slightly, giving your body time to use what it needs while easing the load on your kidneys. Now, mistake number 2. Combining magnesium with multiple other minerals or medications without timing them properly. This one's very common. People take a multivitamin in the morning, calcium at lunch, and magnesium glycinate at night, thinking they're spreading things out. But sometimes these minerals overlap in your system longer than you think. For instance, calcium and magnesium both use similar transport channels in your kidneys. So if calcium levels are still high when you add magnesium, your kidneys have to work overtime to process both. Similarly, certain medications, like blood pressure pills, diuretics, or antacids, can either increase magnesium retention or promote magnesium loss. Either way, they alter your kidney's workload. The solution is timing and spacing. If you're taking calcium, separate it from magnesium by at least 4 hours. If you're on prescription medications, ask your doctor or pharmacist how magnesium might interact with them. And here's a quick practical tip: magnesium pairs beautifully with water-rich meals. Think salads, soups, or lightly steamed vegetables. The natural hydration from those foods supports your kidneys while improving magnesium utilization. Finally, mistake number 3, ignoring hydration and nighttime kidney rhythm. Most people don't realize that kidney function changes throughout the day. During daytime hours, your kidneys are more active, filtering and balancing electrolytes as you eat and move. But at night, filtration slows down as your body goes into repair mode. If you take magnesium glycinate right before bed without enough hydration, it can raise your magnesium concentration at a time when your kidneys are least active. Over time, that adds up to stress on your filtration system. So what should you do if you prefer taking magnesium before bed? which is fine, especially for relaxation and sleep. Drink a full glass of water 30 to 45 minutes before you take it. That gives your kidneys the hydration they need to safely manage the mineral overnight. Or, if you tend to wake up at night to urinate, consider taking your magnesium earlier in the evening, say about 2 hours after dinner. That's often the sweet spot for absorption and kidney comfort. Now, I also want to highlight one lifestyle habit that's quietly undermining magnesium balance and kidney health: low-grade dehydration from caffeine and salt. If you drink several cups of coffee or tea during the day, or you consume salty processed foods, your body loses more water and electrolytes through urine. When that happens, magnesium levels fluctuate wildly. And when magnesium levels swing, your kidneys have to adjust repeatedly, almost like hitting the gas and brakes every few minutes. Over months or years, that constant adjustment wears them down. So here's what I recommend: for every cup of coffee or tea, drink an equal cup of plain water afterward. And if you're having a salty meal, say pizza, cheese, or deli meats, make sure to increase your water intake over the next few hours. These small changes make a huge difference. They reduce kidney strain, stabilize electrolytes, and allow your magnesium supplement to do what it's meant to do: support your energy, your sleep, and your heart. Now, before we wrap up, I want to share a kidney protection plan I often recommend to my patients. A few simple daily habits that keep your magnesium balanced naturally, even before you reach for a supplement. It's a short list, but it works wonders. And I'll walk you through it in the next part, including how to use food, timing, and small hydration cues to make magnesium glycinate safer and more effective for life after 50. Now that you know what not to do, let's shift toward what you can do: practical, science-based habits that keep your kidneys protected while getting the full benefits of magnesium glycinate. Think of this as your kidney protection plan: small steps that support both your magnesium metabolism and overall kidney function. The first step is simple but powerful. Build hydration into your day, not just at the end of it. Most people wait until they feel thirsty before drinking water, but by that time, your kidneys are already working harder than they should. When your body's water balance drops, blood becomes more concentrated and magnesium levels can appear higher than they really are. That means your kidneys must filter extra magnesium out of thicker, denser blood, and that takes effort. Instead, sip water throughout the day. I often tell my patients to think in threes: 3 glasses before noon, 3 before 6 p.m., and at least 1 more in the evening. If you like, you can add a slice of lemon or cucumber. That mild flavor encourages regular hydration and adds a small antioxidant boost. The second step: get magnesium from food first. Supplements are helpful, but real foods provide magnesium in forms that are naturally balanced with fiber, antioxidants, and other minerals. These combinations make absorption smoother and easier on your kidneys. Some of the best magnesium-rich foods include leafy greens like spinach, Swiss chard, and kale, nuts and seeds, especially pumpkin seeds, almonds and cashews, whole grains like oats, brown rice, and quinoa, legumes, beans, lentils, and chickpeas. A single cup of cooked spinach, for example, provides nearly 150 milligrams of magnesium, about half of what many people need daily. When you get magnesium through food, it enters your bloodstream slowly alongside other nutrients that your kidneys can handle comfortably. It's like easing into a warm bath instead of jumping into a cold pool. Now, the third step: match your magnesium intake to your daily rhythm. Your body's needs change throughout the day. During the morning and afternoon, you're burning energy, using muscles, and activating your nervous system, all processes that rely on magnesium. Evening hours are for repair and relaxation, when magnesium helps calm the nervous system and support quality sleep. So instead of one large dose, it's often better to split your magnesium glycinate into 2 smaller doses, one earlier in the day after lunch, and another one to 2 hours before bed. This approach reduces the filtration load on your kidneys, keeps your magnesium levels steady, and supports both daytime energy and nighttime recovery. The fourth step, support your kidneys with foods that naturally protect them. Certain foods contain bioactive compounds that improve kidney blood flow and reduce inflammation. Berries, especially blueberries and cranberries, are excellent for this. So are foods rich in healthy fats like avocados, olive oil, and walnuts. Even something as simple as drinking green tea once a day can help. It's rich in catechins, which help protect the small blood vessels that supply your kidneys. And here's one more: watch your salt and processed food intake. Sodium causes the kidneys to retain water and work harder to maintain balance. Reducing salt by even 20% can make a measurable difference in kidney function and blood pressure. Finally, and this one's often overlooked, give your kidneys rest days. You don't need to take magnesium supplements every single day. Taking a day or two off each week, what I call mineral reset days, allows your body to use up stored magnesium and gives your kidneys a short break. If you're getting some magnesium from food, these rest days won't cause any deficiency. In fact, they help your body recalibrate naturally. So to recap the kidney protection plan: 1. Stay hydrated throughout the day. 2. Prioritize magnesium-rich foods. 3. Split your supplement into smaller, timed doses. 4. Eat kidney-supporting foods daily. 5. Take rest days to give your kidneys a break. These steps sound simple, but they create a powerful synergy. You're not just protecting your kidneys. You're improving your heart health, stabilizing your energy, and supporting healthy aging from the inside out. In the final part of this video, I'll share what warning signs to watch for, the early clues your body gives when magnesium levels or kidney function are off, and how to respond before things get serious. Now, before we wrap up, let's talk about something essential: how to listen to your body. Because your body gives you early warning signs long before any real damage happens. And when it comes to magnesium and kidney health, those small clues matter. The first clue is unusual fatigue. Not the kind that comes from lack of sleep, but that sluggish, heavy feeling even after rest. This happens because excess magnesium can lower blood pressure and slow down your heart rate just enough to make you feel drained. If your kidneys are struggling to clear it out, that fatigue lingers throughout the day. The second clue is muscle weakness or cramps that don't improve even after taking magnesium. That might sound confusing. After all, magnesium is supposed to help with cramps. But when the balance tips too far, it can actually make muscle signaling less efficient. So if you're supplementing regularly but still feel twitching or weakness, it might not be a lack of magnesium. It might be too much. The third clue, nausea or mild digestive upset that starts shortly after you take your supplement. Many people mistake this for sensitivity to magnesium itself, but in reality, it's often your kidneys sending a gentle signal that your electrolyte balance is off. And the fourth, most overlooked sign is changes in urination patterns. Going too often, especially at night, or producing less urine than usual. This is one of the earliest ways your body tells you that your kidneys are under strain. If you notice foamy urine, swelling around your ankles, or puffy eyes in the morning, that's your cue to check in with your doctor. Now, if you recognize any of these signs, don't panic. The good news is that most kidney-related magnesium imbalances are reversible when caught early. Here's what to do. 1. Pause your supplement for a few days. Let your kidneys catch up. 2. Increase hydration. Aim for 68 glasses of water spaced evenly throughout the day. 3. Eat magnesium-rich foods instead of supplements for a week. Leafy greens, nuts, seeds, and legumes will provide what your body needs without overwhelming your filtration system. 4. Ask your doctor for a simple kidney function test. It's a routine blood and urine test that checks your creatinine and GFR levels. It's quick, inexpensive, and gives you a clear picture of how your kidneys are performing. And if your kidney function is healthy, that's wonderful. It means you can safely continue using magnesium glycinate. But now, with the right awareness, timing, and hydration habits in place. Here's one more science-backed insight. Your kidneys and your blood vessels work as a team. When your kidney health improves, your circulation improves too. And better circulation means more oxygen and nutrients reaching every organ, your heart, brain, muscles, even your skin. That's why protecting your kidneys isn't just about preventing disease. It's about improving longevity and quality of life. For men over 50, this becomes especially important as testosterone levels naturally decline and muscle mass decreases. Your kidneys are quietly doing extra work to balance hormones, filter byproducts, and maintain electrolyte stability. Taking care of them with good nutrition, proper hydration, and mindful supplement use is one of the most powerful anti-aging strategies you can practice. So, if there's one message to take away from today's video, it's this: magnesium glycinate is an incredible supplement, but it's not one size fits all. Your body changes with age, and your kidneys deserve respect for the work they do every minute of the day. Take magnesium smartly. Time it well. Hydrate consistently. And most importantly, listen to your body's subtle messages. I always tell my patients your body speaks softly before it ever shouts. The earlier you listen, the healthier your future becomes. If you found this helpful, share it with someone you care about, especially those who might be taking magnesium every day without realizing the importance of kidney balance. Because the more people understand how to protect their inner health, the stronger and longer we all live. Thank you for watching. And remember, the best medicine often begins with awareness. I'm Dr. William Ly. Take care of your kidneys, and they'll take care of you.